Hi, welcome back to ACC 2023. A lot of controversy out there about exercise in patients with hypertrophic cardiomyopathy. I'm joined by two experts today, Rachel Lampert and Sharlene Day. Talk to us about the LIVE-HCM study.
So we know that exercise has many benefits for everybody, but for patients with HCM, there's been a lot of uncertainty about what level of exercise is safe and whether vigorous exercise or competitive sports participation could increase one's risk of having a serious arrhythmic event. So really the purpose of the LIVE-HCM study was to quantify the relative risk.
So what do you do?
So we enrolled individuals with hypertrophic cardiomyopathy, or those who carry a gene for hypertrophic cardiomyopathy, aged 8 to 60, across the whole spectrum of exercise, from those exercising vigorously or even competitively, through those exercising moderately, and the less active or sedentary individuals. We followed them prospectively for 3 years, asking them to fill out an online survey every 6 months about our pre-specified endpoints, which included resuscitated cardiac arrest, appropriate ICD shock for ventricular arrhythmias if they did have an ICD, and CVP felt to be potentially arrhythmic, as well as quantifying all-cause mortality. What we found was that those exercising vigorously, which was about 660 of our total 1660 individuals, did not have a higher risk of the causing endpoint over the 3 years of follow-up. The overall risk was low, less than 5% across the 3 years across the group. What we found was a hazard ratio of 1.01 close to unity for those exercising vigorously compared to the less active. We looked at a number of subgroups who found similar hazard ratios. For the primary group, we had specified a non-inferiority analysis, and the confidence intervals did not cross the specified hazard ratio of 1.5.
So what's the bottom line? What's the take-home message?
So, overall we found these data very reassuring that the absolute risk of arrhythmic events is very low, and that the relative risk is not increased for exercising vigorously or even competitively. And so these data really don't support restriction from vigorous exercise for patients with HCM or even for competitive sports, and they'll help to inform shared decision-making discussions between patients and their providers.
Thanks, you two, and thanks to all of you for joining us here live from ACC 2023.